Airborne pathogens are any organism that can cause disease and spread throughout the environment via the air. Typically, airborne diseases travel on dust particles or respiratory droplets by way of sneezes, coughs, laughter, and close personal contact. Airborne pathogens can enter through the eyes, nose, and mouth. Some of the most common examples of airborne diseases include influenza, chickenpox, and whooping cough. Although these diseases can cause serious harm and even death for some patients, they're usually easily curable if diagnosed and treated in time. More life-threatening airborne diseases include meningitis, anthrax, SARS, tuberculosis, and smallpox, though vaccines have advanced such that these diseases can be prevented. Transmission occurs, 1, through the air. If you are ill, use good hygiene. Cough and sneeze into a tissue or sleeve. Dispose of tissues in a trash can. Wear a surgical mask. Keep a distance of 6 feet between yourself and a sick person. 2. Touching contaminated objects. Avoid touching contaminated objects. When around ill people, avoid touching your eyes, nose, and mouth. On average, people touch their face 16 times an hour. Keep an area disinfected to kill pathogens that have contaminated surfaces. 3. Hand contact. Wash your hands thoroughly if in contact with an ill person. Wash for 20 seconds, which equals singing happy birthday twice, or use alcohol-based hand sanitizers. Keep current on vaccines, although not all airborne pathogens have vaccines. According to the CDC, healthcare workers face a greater risk of exposure to ABPs than the general public, as do correctional institutions, shelters, schools, long-term care facilities for the elderly, and drug treatment centers. When you are ill, call a doctor if your fever is high. Ask your healthcare provider whether antiviral medications are needed. Stay home to prevent spreading the illness. Rest. Drink plenty of fluids. Take recommended medications. Get medical care right away if you experience difficult breathing or chest pain, purple or blue discoloration of the lips, vomiting and unable to keep liquids down, signs of dehydration such as feeling dizzy when standing, being unable to urinate. Pulmonary tuberculosis, TB, is an airborne disease that in 2010 infected nearly 9 million people around the world. A TB exposure control plan based on OSHA guidelines should be developed if this is a possible work incident. Before providing care to a patient with active TB, OSHA requires that all employees be fit tested to make sure they know the correct size of a particulate respirator mask and how to properly fit it to their face. Include an annual education program for all employees, annual TB testing and management of any TB exposures. Employers must provide a workplace that's free from recognized hazards that can cause death or serious physical harm. When feasible, employers should control exposure to TB by using ventilation, isolating patients, and confining certain operations to restricted areas. When these controls aren't possible, they must provide respirators to all employees who breathe contaminated air. The two most critical elements of a personal respiratory protection program are training of healthcare workers, selection of appropriate, well-fitting respirators. Anyone working in an area where there is a possibility of exposure to tuberculosis must be fitted for a respirator HEPA filter mask. Employees must wear respirators whenever they enter a room housing someone with a suspected or confirmed case of TB. OSHA requires that warning signs be posted on respiratory isolation or treatment rooms and gives specific measures that must be taken to interact with patients. Employers must also use biological hazard tags on components of air systems so employees working on them know that they transport contaminated air. If an employee who has been exposed to someone with active TB develops a tuberculosis infection, the employer must record the case on the OSHA 300 log. Positive TB skin tests and TB disease are both recordable. If an infection goes on to develop into disease during the 5-year maintenance period, the employer must update the original entry in the log to show the new information. Employers must keep records of all employees who have been exposed to TB in the workplace, a record of their TB skin test results, and medical evaluations and treatments. A copy of the current fit test record for each respirator user must also be kept. OSHA may have access to these records upon request, and OSHA will use appropriate safeguards to protect employee privacy. Treatment for pulmonary tuberculosis involves taking antibiotic medications to eliminate the bacteria. This treatment may be for more than 6 months, depending on the severity of the tuberculosis.